Hi, this is Dr. G. Nair. I am going to videotape how to do some anterior tibialis strengthening. I've got a little band here. I'm going to get ready, loop around my feet. Actually, no, false alarm. I'm going to crisscross actually here, and I'm going to put the band around the lower foot. This is very similar to the setup for the posterior tibialis muscle strengthening. So I've got my feet crisscrossed. I've got the band around the lower foot. And what I'm going to do now is dorsiflex my lower foot. So bring my foot up so it's not in a relaxed or kind of like a down position. So we're looking at the lower foot. I'm going to bring my ankle up to 90 and then a little pass. And I'm going to just go up and in. And I'm not going to use my toes. My toes are just mostly relaxed. Here I'm going up and in. And you'll see when you're doing this, a tendon kind of activating or really getting tight. By activating, I mean it's getting tight. And it's right at the top and front inside of my ankle. So I'll know that I'm doing the right muscle because I'll see that sucker prominent and then relaxed, and then it's prominent and then it's relaxed. And so I know I got the right area. What I don't want to do is, use my toes too much. I'm not trying to do extensor work. Just kind of come ankle slightly up and in. Sometimes I'll refer to this as windshield wiping because it's just kind of like a wiping. Your heel's mostly staying where it is, and the rest of your leg should be very stable. You'll notice, we can't see it great, but my right knee, I'm doing the exercise on my right side. My knee is staying exactly where where it was, with the patella pointing up, and it's just coming in and relaxed and in and relaxed. I'll show you the setup again. I'm going to crisscross my legs. The lower foot is doing the exercise, and putting the band around the arch there, and grabbing my little my rope in my hand, and the lower foot's now doing the exercise. And I want you to watch my knee. It's just staying right there. I've got my ankle up and in and up and in, and I do it in this. I use this position. There's so many ways to do this exercise, but I'm doing this position because I have patients do the posterior tibialis all the time, and they're already in this setup, so it's just an easy transition to go from this with the same setup and change little things about your foot position and the direction. What you'll see is, again, my knee is just staying exactly where it is. I'm not rotating my leg when I'm doing this. And it's fun to sort of pick up on differences in your two sides. Like, oh, my right one is a little stronger, my left one's a little stronger, or it has a little bit more motion, because you'll find that our feet and our body is asymmetric, and different areas have different strength and flexibility, and that's okay. And so you'll follow the reps and sets that I recommend in your notes, and hopefully this is helpful. I know it will be too. My patient's asking for it, and so thank you for your time. I hope that was helpful. Bye-bye.